Viral, who is the chief organizer of this IC293.
Thank you, sir. So, as rightly summed up by Dr. Pankaj Shah, Consumer Protection Act has not barred us or has given us any immunity after its amendment in 2019, and there are some landmark judgments by court through which we have to learn some important lessons. So, every one of us has faced a legal notice, and all of us fear about some legal actions in the future and lose some sleep over it. And if we don't learn from history, we are doomed to repeat it. So, Supreme Court judgment on CPA 2019 held that the mere repeal of the 1986 Act by the 2019 Act without anything more would not result in exclusion of healthcare services rendered by doctors to patient from the definition of the services. So, it is settled in this court judgment of Bombay High Court. Service rendered to a patient by a medical practitioner would fall within the ambit of service as defined in section 210 of the Act, and it would not exclude the service rendered by them from the ambit of the Act. Consumer Protection Act has laid down some broad criteria for doctors. It is duty cast upon doctor to provide the fact that no sort of negligence took place inside the OT. How much to charge as fee for medical services is the choice of the medical practitioner. Doctor is not entitled to approach consumer forum for recovery of professional fees. So, if the patient doesn't give you fee, you cannot go to consumer court. You have to go to civil court or whatever action, other criminal court. Fees paid for operation also includes post-operative care. So, also death on table and direct arrest of doctors, these are all well settled. You cannot arrest directly a doctor on complaint. You have to go through IMA local body and through our government college or CS. If they give a report that negligence there, then only they can arrest it. Case can be filed, but arrest of doctor is stayed. Also same regarding death on table in the Jacob Matthew case. So, it is no longer a cognizable offence but a bailable offence. Judgment, some landmark judgments by state and national commissions which protects or helps us ophthalmologist. I will take this first and we will go to the other part later. So, it is not negligence if the nucleus drops occurs and if removal is not feasible. It is not possible to determine the exact power of oil before surgery, so a post-operative 90% may require additional glasses. If dislocation of oil takes place, if patient does not follow the instruction of doctor, and as a result benefit of operation are reduced. Eye surgeon performing YAC PI to rectify IOP and there is subsequent vision loss, and if a patient gets an infarct while doing a minor operation. We will take some examples. So, the complainant suffered a PCR with nucleus drop at the time of cataract surgery. There was delay in the second surgery to remove the lens, dropping an IOL implantation as patient had undergone uncontrolled sugar. Further, patient had RMD and DM, and she was counseled as GVP. The ophthalmologist submitted extract of textbook, and under the head of other complications, it is clear-cut mentioned that posterior capsular rent with vitreous loss is one of the complications of cataract surgery. So is nucleus dropping through PCR. In this case, the complainant did not produce any evidence or create circumstances to hold that the doctor did not take reasonable care, degree of care and skill in conducting the operation, and therefore the said decision supports the case of the doctor. One more case, we have withheld the names of the doctors because some of them are also there in this campus. So, on 17th of October 2007, the patient underwent IOL implantation under the doctor's care. Post-operatively, he did not have clear vision and diffraction showed error of +14 diopter. Most of the investigation relating to the eye problem and selection of lens with its power was done through sophisticated machines. Best possible treatment to patient was provided, and all sorts of care pre and post eye operation was taken by this institution. Patient underwent IOL exchange at another institute, after which he filed a lawsuit. No expert opinion or medical test have been produced to prove the selection of IOL was faulty through the scan machine, and implantation of said lens by the doctor was wrong. After cataract surgery and IOL implantation, dislocation of the lens was noted by another specialist 2 weeks later, who explanted the lens and implanted SFIOL. This was not noted by the first operating surgeon due to high grade of cataract pre-operative and due to post-operative corneal edema. ILMP was also done. Patient did not follow up properly post-operatively and directly consulted the second specialist. Consumer Protection Forum concluded that IOL dislocation was a known complication of surgery and that patient was contributor negligent in not following up properly. The court further submitted there are no expert opinion or document to prove negligence on part of doctor number 1 and 2. In Uma Tiwari versus State of MP case, patient had an attack of primary angle closure glaucoma for which YAG was done, following which she developed CRVO and claimed negligence on part of the doctor. Court held that doctor was not negligent as he was the best judge who at the spur of the moment to carry out laser treatment instead of anti-glaucoma medication in order to ensure that there is no damage to the retina and no loss of vision takes place. The patient was explained regarding YAG-PA procedure and its complication. Patient vision was deteriorated because of CRVO. The cause may be hypertension, but the patient did not take any treatment for hypertension at that time. In writ petition civil number 1247 of 1986 Supreme Court, these are some landmark judgments against conduction of camp, and guidelines for the camps were laid down after this case. The Supreme Court laid down guidelines for conducting camps. So Lions Club in Khurja, UP conducted and opened an eye camp at Khurja after obtaining necessary permission from CMO. And a team of doctors under Dr. XXX was invited to the surgical job. The club published propaganda literature with attractive slogans: get operated and go home, no restriction on food, no bed rest, no stitches to be removed. In response, thereto substantial number of patients visited the camp. 108 patients were operated and 84 developed endophthalmitis. The fault was in the saline bottle procured by government authorities. Government was asked to pay compensation of 5K to each person, and after this the following guidelines were set. Compensation was that there was no approval to run the hospital, consent to operate was not taken from the State Pollution Control Bureau, and there was no proper design and maintenance of the operating room. There was no anesthetist, no pharmacist, and no facility to do post-operative lab test, and there was no formalin which was indented despite it being out of stock by the head of the hospital. Court also frowned about the fact that, knowing fully well that IOL costs only rupees 56, for the purpose of enticing villagers, they had distributed pamphlets stating the cost of the intraocular lens will be 1000 to 3000 rupees. Despite Pseudomonas having cultured from the ringer lactate being used from the manufacturing company was absolved of any wrongdoing because the sample was sent for test which was of some different batch and it was found to be satisfactory. So the guidelines that were set after this landmark case was a qualified experienced ophthalmic surgeons registered with Medical Council of India or State Medical Council should only perform and supervise the operation. Camp should not be used as an unsupervised training ground for PG students. There should be a pathologist to examine urine, blood sugar, etc. It is preferable to have a dentist to check the teeth for sepsis and a physician for general health checkup. All medicines, consumables to be used should be of standard quality, duly verified by the doctor in charge of the camp. In this interesting case, a cataract surgery was performed on 66 patients at a reputed hospital in South India. 61 lost their complete vision in the operated 66 patients. Out of 66, 61 lost their complete vision in the operated and 5 partially lost the vision. 61 were fully blind and 5 were partially blind. The Chief Judicial Magistrate which heard the case convicted Dr. X, Director of XX Institute, CMO and Chief Administrator under Section 338 of culpable negligence and endangering the personal liberty of the patients. Court also ordered a payment of compensation to the victims ranging from 2.28 lakhs to 5.17 lakhs according to victim's age. So this case was used as a compensation was fixed as per the Workman's Compensation Act for the first time in ophthalmology. So Workman's Compensation Act, according to your age, you will be given compensation was used as a scale for this case, and it is now applied in every cases of compensation. So it's a vicious cycle. Cost to be paid even for providing free services. It is now time for us to introspect where we are and what further course we have to take. With exceptional high compensation being granted today by the Indian courts for loss of vision even against government hospitals, the alarm bell should start ringing a long time ago. In V. Krishna Kumar versus Tamil Nadu judgment, 2.65 crores as compensation, including 6% interest in this case for failing to diagnose a case of ROP. So in this, the implication of this judgment for ophthalmology is in terms of quantum of compensation being awarded for loss of vision is enormous. Such is also for refractive surgeries. Recently, a patient following LASIK surgery for high myopia underwent toric implantable ICL, and for unsatisfactory results claimed a sum of rupees 6 crores as compensation. Thankfully, the court did not agree to such exorbitant claim, especially when the boy completed higher education after the surgery and was gainfully employed and was very active on social media as found by the investigator hired by the hospital. So the court dismissed the plea. Obviously, this is again one more Pandora's box of level use of drugs. Especially nowadays, we have been using anti-VEGFs. It is well established that Boehm's test must be applied, and doctor might be able to avoid a claim for negligence if he can prove that the other medical professionals would have acted in the same way. Medical records, will be covering this in the next talk by Dr. Rajesh Joshi, medical records and ophthalmologist. Also, poor record is always a recipe for disaster, and also indemnity insurance. Agrawal sir will be highlighting these points. So, in short, indemnity insurance is must for all of us, and it should be the quantum which should be decided. We will get details in from Dr. Santosh Agrawal sir. So, thank you so much for attending this